Okay, so some of you might be asking, how does a 39-year-old Filipino American from the city of Chicago get coronary artery disease so bad that it requires open heart surgery? So I'm going to go back into and rewind a little bit and talk about all the things that I did and did not do that likely led up to this point. I guess more recently it started back in January of this year when I turned 39, and I knew that as I approached 40, I made the decision that I wanted to be healthier and in better shape than I was in my 30s. But before that, I knew that there were some things that I needed to fix. One of them being, being a little bit more attentive with my health. It had actually been many, many years since I'd last gone to see a doctor. So I knew that I needed to, get a physical, check my blood work and all that before I really pushed to do things like exercising and changing my diet and all that. I wanted to have professional advice before I took that step. Another thing that I started to notice was that as I was walking to work, I'd have about a 10-15 minute walk every day, and I started to notice that I was getting tightness in my chest during certain points throughout my walk. I knew that that was not good, that there might be something more to it other than just assuming it's just heartburn or just something I ate that morning. I also noticed that, especially when I would visit my family out in California, that playing with my 6-year-old nephew would get me tired a lot quicker than it should. I did notice that I was getting short of breath, so I thought that all of those things were just a part of getting old. That it wasn't anything to be too concerned about. But knowing that I had not seen a doctor in quite some time, that I should at least just double check and make sure that it wasn't anything serious. So I looked up a primary care physician, and we had a couple meetings, and I told him about the issues with my chest, and also the fact that I had a very rapid heart rate, a very fast heart rate that was probably abnormal. So that's what led to him referring me to a cardiologist. And so the cardiologist from there did tests on me and put me on some medication, did an EKG test on me, and found out that there were that parts of my heart was very weak. That, of course, led to the other tests that led to the recommendation for the open heart surgery. So how did things even get there? Well, the first thing is just having a long history of having a poor diet. I loved my carbs. I love pasta, I love rice, I love bread. All the things that I should not have been eating, I was eating. I wasn't big on the sugary drinks, but I was really into fruit juices like orange juice, apple juice, and especially coffee. Coffee with a lot of sugar, a lot of cream, things like that. And so that was number one. When you're young, you think you could eat anything, and you do eat anything you want. Knowing that I wasn't in the best shape, but I wasn't crazy obese or anything. And I figured, well, I'm not like super fat, so this should be fine. If there was something, if I was overdoing it, then I would be able to see it, or I would be able to feel it. So I kind of took a lot of that for granted. Part of that also was just the accessibility of junk food and fast food. Being single and not spending time to cook for myself, I would immediately just take the easy way out If I was heading to work, I would just swing by Dunkin' Donuts every morning, get some food there, get a super high sugary coffee. When I got to work, working downtown, having access to all of these restaurants, whatever you want. You got your Chipotle, you got your McDonald's, you got your Panda Express, taking advantage of the convenience of it all. Year after year after year, definitely was not good for me. And then even when I went home, I just was too lazy to bother to be bothered with mindful grocery shopping and really cooking food. I would just get like frozen pizzas and ready to eat frozen meals. I didn't visually see myself gaining too much weight that I thought everything was fine. Another thing that contributed to this was the fact that I had very little exercise. I figured that I walked about half an hour a day, a couple minutes to the train, and then once I got off the train, it was usually about a 10-minute walk to my office, and I did that back and forth, so twice a day, 5 days a week. And I thought that was enough to feel like I was doing something, like I was getting some form of exercise. And then at the same time, I had a desk job, working in advertising, sitting behind a desk 8-10 hours a day. And in addition to that, the job itself can get pretty stressful. I don't blame too much because that is part of the appeal for me in the profession that I'm in, thriving on high pressure situations. Because that is just the nature of my job. That's when I've seen that I've done my best work, but not really countering it with time to slow down and balancing it with time to step away and meditate for a little bit and then come back. That part I was very neglectful on, and something I should have been a bit more mindful of to help balance the high pressures of what I do every day. And then last but not least, genetics. I do have a family history. High cholesterol, hyperlipidemia, which, the triglycerides, for me were through the roof when I eventually got it tested. Having high cholesterol is what leads to the plaque that clogs your arteries. On top of that, I also found out that I had developed type 2 diabetes, which is usually hand in hand. And I remember the first, after getting the diagnosis, going to the grocery store and just being really pissed off at myself and mad at how I can't have this, I can't have that, I can't eat that anymore, and all the things that I kind of I feel like I really screwed myself because of that. And so all of that combined with the fact that I wasn't checking my health by professionals regularly, all compounded and built up over the course of the last couple of years, and that's what led to my coronary artery disease. So this I kind of discovered back in February when I finally met with my doctor, and yeah, it hit me like a ton of bricks. And for those of you who follow my art social media, you might have noticed that I was pretty quiet for almost 2 months. And that was a result of finding out about my health situation and getting pretty sad about it. I was just very demotivated to really do anything else. At the same time, I was motivated to change my diet. I started learning how to cook for myself. I started incorporating fish and more vegetables into my diet. And then I totally reduced my carb intake. It was very hard. It still is pretty hard right now. So if anything, this post, hopefully if there's any of you that as you approach your late 30s, early 40s, who might also be in my position where you kind of just take everything for granted as far as what you're putting into your body, thinking that, oh, I'm young and this won't, I don't really feel like this is affecting me, so I'm just gonna do the most convenient route and eat whatever's available. It caught up to me, and that's there's not too many things in my life that I regret, but I certainly regret that. If you haven't seen a doctor just to get your blood test, I highly recommend you do that. If you have a family of heart disease, high cholesterol, high blood pressure, it won't hurt to get that done. Knowing that this operation is kind of a second chance for me, that God willing, with the diet and the exercise, that I will be able to hit that goal of being in better shape, being more fit in my 40s than I was in my 30s. So that's all for today. Tomorrow I'm going to go into the immediate preparation that I need to do for the night before the surgery, all the things that I was instructed, and also some of the recovery plans and things like that. So till then, thank you again for watching. Thank you again for all the messages and the show of support, and I'll be back tomorrow with another update.